Banerji, General Londhe, General Aftab, ladies and gentlemen, welcome you back to the session on remote health monitoring technologies, which is indeed going to be exciting. We heard things about this mentioned by General Kanitkar and General Puri in the morning, and I think all of us are eagerly waiting to know what is being done in this field. On the lighter side, while traditionally an average Indian would always want to be personally seen by a doctor, he won't get that satisfaction till the time he has been seen. But then there are others, perhaps like me, who have got that white coat fear or whatever it is called, and the moment you physically are being seen by one, you have your blood pressure shooting. So this is on the lighter side, but I think this remote health monitoring is indeed a blessing. So without much ado, it's my privilege to walk you through the varied experiences and accomplishments of Generals Banerji and General Londhe. Starting off with General Banerji, the chair, decorated officer, extremely decorated, Param Vishisht Seva Medal, and he retired as the former DGAFMS, and he holds a postdoctoral degree, postgraduate degree in cardiology, and is a cardiologist indeed of great repute. He was Deputy Commandant Command Hospital in Northern Command, and also at the Army Hospital Research and Referral. And he's been a consultant medicine and cardiology in Command Hospital Eastern Command as well. And he has held prestigious appointments of the Head of Department Medicine and Cardiology at Military Hospital Cardiothoracic Center, Pune, and at Army Hospital Research and Referral. So he has also performed the duties of Dean Academics at Army Hospital Research and Referral. And prior to being appointed as the DGAFMS, General Banerji held the prestigious appointments of DGMS Army as well as DGMS Navy. So, I really envy all the medical practitioners. They get a ringside view of all the three services. And he's also been Commandant of AMC Center in College Lucknow. Then Banerji was the only medical member in the Indian Army Mount Everest expedition way back in 1985. So, hearty welcome to you, sir. And a few words about General Sanjay Londhe, Param Vishisht Seva Medal, Sena Medal. He now is a consultant in health sciences at Bharati Medical Foundation, and he has been the former DG of dental services. He holds a postgraduate degree in orthodontics and dentofacial orthopedics, and he has indeed handled very challenging assignments: ADG Dental Services, DDG Dental Services, Equipment and Standardization, Commandant of the Command Military Dental Center at Pune, Consultant Orthodontics, and Senior Specialist Orthodontics. Earlier, he has also commanded the Military Dental Center at BEG and at Armed Forces Dental Clinic, also commanded the AFDC Delhi. And he was on deputation to the Indian Peacekeeping Force in Sri Lanka in 1987. That was challenging. So, and he has had more than 40 international and national publications to his credit, and he's a postgraduate. He has got postgraduate teaching experience of over 22 years. So we are indeed fortunate to have such accomplished chair and keynote speakers. So without much ado, over to General Banerji.
Managing healthcare through the air. A one-liner that sums up today's very important session on remote healthcare monitoring technologies. First and foremost, I'm extremely grateful to the organizers, Jan Srivastava and Aurora sir, for having invited me to chair this very promising session, and also to Sanjay for having given AFMS an entire day of deliberating and loud thinking. I, as the chairperson of this session, will give an overview of what it means, what remote monitoring technology is about, and then I will leave it to the speakers to go to the specifics and the industry presentation, and thereafter I'll come back for further elucidation. Communication technology has never been as relevant as it is today, and there are reasons to support and justify what I say. Life expectancy has never been as high as what it stands today. There are statistics to predict that by 2025, the population of those beyond the age of 65 years would be double of what it was in 1995. Now, this elderly population has all chronic diseases. This is the population that requires healthcare, repeated healthcare. These are the populations that is prone to both acute and chronic illnesses. The next point is the glaring example of the pandemic. Never before has remote monitoring gained so much of relevance as what it has done during the pandemic. The large number of unprecedented cases, the risk of contracting infections to the healthcare workers, the non-availability of beds and infrastructure at the COVID centers. The answer to all this has been remote healthcare monitoring technology. Another thing which is of importance to us is combat medical care. Statistics in the Vietnam War signify there has been a large disproportionate number of loss of lives of the healthcare providers as compared to the infantry people. This monitoring technology in the US has gained a very far thrust in that they are now monitoring how infantry soldiers can be remotely controlled and monitored by way of predicting hemorrhage, which is a major cause of loss of life during trauma in the battle. So this is the relevance of remote healthcare monitoring technology. What are the types of remote healthcare monitoring technologies? As we are aware, it is such a promising and challenging branch that the industry is heavily committed into bringing out newer gadgets, newer models, newer technologies. Some are already patented, some are in the pipeline, and others are being conceptualized. To start enumerating, right from head to toe, there are monitoring technologies and techniques and gadgets and products, whatever we call them, right from monitoring patients with neurological diseases, Alzheimer's, Parkinson's disease. There are technologies to monitor patients with mental health issues, schizophrenia, depression, anxiety. Techniques and gadgets to monitor patients with cardiac disorders, arrhythmias, silent MIs, atrial fibrillations, congestive cardiac failure. Gadgets to monitor patients with respiratory disorders, COPD, interstitial lung disease, bronchial asthma. Patients of endocrinology disorders, diabetes, obesity, they are being monitored by these techniques. Patients with renal disorders, those who are dialysis dependent, are being monitored with these technologies. Compliance of medicines, whether the patient is taking the medicines as prescribed, are being monitored by sensors using this technology. Patients with advice to weight gain or weight loss therapy are being monitored by this sort of a technology. And last but not the least, in the US, they have seen that 1/4 of elderly population has sudden falls in the house, which can be catastrophic, either leading to a subdural hematoma, a fracture neck or femur, leading to pulmonary embolism. So there are now sensors which diagnose such falls and patients are given early treatment. This is some of the large gamut of remote healthcare monitoring technologies which the world is exposed to and which is something which is still in the offing. Now, what are the type of sensors? The various type of sensors are all, we are thinking of smart hospitals, smart healthcare, smart nurses, smart doctors, So we have smart sensors for this technology, be it a smart watch, smart wristband, smart vest, smart clothing, AR, VR spectacles. This is the entire gamut of sensors which is giving rise to this technology. How does it help the healthcare provider? It helps the healthcare provider by transferring data for him to respond, by increasing the quantity of healthcare, by improving the quality of healthcare, by reducing hospitalization and therefore keeping beds for more critical patients, as we saw during COVID. How does it help the patient? Trust and transparency is what every patient looks forward to. Here you have a connect with the doctor. Early access gives rise to early intervention practices. One does not wait for the disease to deteriorate. Relapses are prevented by this sort of a monitoring technologies. How does it help the administrator? Reducing costs and financial burden in maintenance of equipment in the hospital. So what are we looking at? We are looking at an ideal healthcare monitoring technology. So what should the device be like? It should be small, it should be portable, it should allow free movement of the patient whom it is fixed to. The device should be understandable by the patient. And it should be cost effective, it should be dependable, trustworthy. And when we are looking at combat medical care, this device the transmission should not get disrupted by sounds of whatever sounds we have in the battlefield. And the radio frequency of such devices to be used in combat medical care should be matching with the radio frequency in the battlefield. Two shortcomings, as I said, with this sort of a technology, all of our clientele has to be given some sort of a smart watch or a smart mobile. They should be adequately educated and motivated to put on this technology. So with this preview, I now request General Londhe, who we have been colleagues during very difficult COVID times, and he has been adequately introduced by General Srivastav sir. So I will not stand between General Londhe and the audience, and I request General Londhe, he having relinquished his service with the apex and the most sought after appointment of DGDS, he will give the dental perspective of remote healthcare monitoring technologies. General Sanjay Londhe, the mic is all yours. Please unmute yourself.
Yeah, I am audible.
Yes, loud and clear.
May I request General Ravi to start my presentation?
Yes, sir. 1 minute, sir.
Okay. So before General Ravi starts the presentation, I would like to thank the organizers for giving me this opportunity to share screen with such personalities in the medical healthcare, and also General Srivastav, General Puri, General Kanikar, General Banerji, Marshal Kapoor, General Daljit, and if I have missed someone, then my apologies. So let's start with the presentation. The topic for today is the remote health monitoring technologies. And as General Banerji has said, that I would be covering the dental perspective of technologies. Next slide, please. Next slide, please. Yeah. So I have titled my presentation as Redesigning the Oral Health Care for the 21st Century. Next slide, please. We all know that the realities are changing. And with the changing realities, we need to innovate and give some sustainable models of the care delivery. But for that, we have to redesign the conventional dental healthcare. And to do that, we have to embrace the digital innovation to improve the quality, efficiency, and value of the dental service. Digital is a commonplace, and it is now interwoven into the fabric of our daily life. We all know that. Well, these days, with the proliferation of applications like Amazon and etc., there is a growing number of individuals who want a personalized experience in healthcare also. This growing number of individuals are termed as digital natives. They are growing day by day. So there is a emphasis on customized and personalized healthcare experience. The growing emphasis on the health behavior through this digital technology. Now the healthcare provider will be able to monitor the behavior of the patient in a better way. And the healthcare provider will get evidence-based oral healthcare feedback, and he can give a timely and a better advice. The mobile technology has penetrated into the healthcare. This is, there is nothing new in this. It has altered the way in which the healthcare is being delivered through smartphones and through wearables. However, the ability to change the realities, it all depends on the patients and practitioners' adoption and the sustained engagement with this changing reality. Next slide, please. So how does oral healthcare will look in a digital? Well, the user has to be tech-savvy to explore the capabilities of the digital tech. Hence, the dental healthcare provider, that is the dental fraternity, and the user will require to be tech-savvy. Secondly, it will broaden the scope of the dental practice and speed the integration of the oral care with the general healthcare. For example, screening and monitoring of the systemic diseases through the appliances which are worn in mouth. Two ways, a real-time analysis of the data is possible, which will provide the actionable insights to the patients, to the dentists, and to physicians. Next slide, please. So what are the opportunities for remote oral healthcare monitoring technologies? Well, when we think of the dental care, it is always associated with the dental. So dental healthcare outside dental clinic, is it possible? Monitoring of oral health outside the dental clinic is uncommon as on today. But in the coming time, the scenario is going to change because it can improve people's care at home. It can connect everyday activity of a patient to the clinical settings. And it will allow more efficient use of the clinical resources available to the site. So what are the advantages? The users can track their progress and adjust to the home care routines, whatever. So previous slide, please. Users can track their progress and adjust to the home care routines as advised. The healthcare providers can have better screening and diagnostic tools available. The human-computer interaction researchers, they have proposed a number of opportunities available in the healthcare for remote health monitoring. So let's see what those opportunities are. Next slide, please. I'll cover these opportunities under these three broad headings: Tele-Dentistry. Then I'll give three examples of the technologies which are not really latest. They have been into our system also for a couple of years. And then thirdly, Internet of Things. Next slide, please. Well, as we all know, the COVID-19 pandemic challenged the healthcare scenario globally, not only in India, but everywhere. It challenged the existing healthcare scenario. So, what happened that the routine dental procedure got suspended. Well, the traditional dental healthcare is giving the assistance after the establishment of the disease. This routine dental procedure was suspended because dental treatment involves close inspection and intervention. So the dental healthcare providers were in a very high risk group to contract this disease. So out of fear or out of the situation at that time, it was decided, and especially I can talk about the armed forces through the guidance of the then DGAFMS General Banerji. we issued a set of guidelines wherein we guided our officers and men to provide care under defined conditions. So the aerosol generating procedures, they were discontinued, and only emergency procedures and non-aerosol generating procedures were attended to. Will virus become endemic? Well, that is what the speculation is. And if the virus becomes endemic, then will the dental care or the oral care suffer forever? No, we will have to innovate. We will have to find ways and means to provide the dental care irrespective of the virus becoming. So dental practice will have to continue without or with minimal risk. And how will that happen? Is teledentistry a solution to all? No, teledentistry is not the solution. Teledentistry would be one of the means through which this would be achieved. Next slide. Now let me tell you how the teledentistry works. Well, there are basically two types of technologies. We all are aware. First is the synchronous, which is a video or what we are chatting. Here the patient and the provider, they come face to face on screen, and the consultation is done. The second is store and forward. Store and forward means the data is collected at one place. It is forwarded in a secure manner to a server where it is stored. It is retrieved at a third place, and the consultant or the specialist uses the data to give the reports. Third is remote patient monitor. That is, patient wears certain gadgets and certain parameters are monitored through the information which is obtained from the. Fourth is mobile health or M-Health. Well, M-Health, these days we all see the advertisement of Tata Health, the TV. That is nothing but M-Health. M-Health is going to invade our life to a great extent in future. But what does all this it will provide? This teledentistry or this M-Health and wearing so many gadgets and wearables, it will facilitate the dental care, the guidance, the education of the treatment, like telemedicine, which ultimately is a part of the telehealth. The earliest example of the teledentistry I could draw is from the US military project way back in 1994, and they found that it proved to be beneficial for remote dental screening, diagnosis, consultation. So teledentistry has got 4 subunits. First subunit is teleconsultation, and which is most common. The picture is self-explanatory. I need not dwell on this picture for a long time. Here the user and the doctor, they come face to face. The next subunit is telediagnosis. There are various types of telediagnostics setups available. I have just listed a few of them. We will go through them. This system is known as Istomatonet. Here you can see there is a primary care providing professional. Primary care providing professional is contacting the general dental consultant. He is feeding the information obtained at the primary healthcare level. The general dental consultant, after having satisfied himself with the quality of the input given, either gets back with the advice or he consults the specialized dental teleconsultant for the further advice. And finally, a solution is offered to the patient. Next slide, please. Next slide, please. Here is an example of a smartphone for the detection of dental caries. A smartphone has an application with a variety of data to be fed in. A photograph of the mouth of the patient's teeth is captured. The patient's habits, symptoms, and background analysis, etc., are fed. The auto-cropped images are forwarded to the application retrieves the auto-cropped images, and it carries out the detection or the caries detection part. The risk assessment is done. The interactive dental education module is offered to the patient, as well as the clinical resource available to take care of this problem. Next slide, please. Next slide, please. These are two examples of some gadgets which could be attached to the mobile camera or the mobile phone itself or the mobile camera itself. Now these are attachable gadgets wherein a screening of a malignant lesion could also be carried out. And of course, I have, if you ask me personally, I have never used this, but it is possible. It is available in the market. There is a smartphone-based device which could provide a rapid, low-cost molecular. Here you can see a smear slide has been inserted into a gadget, which is attached to the mobile camera, and through the magnifying, various magnifying devices attached to it, the mobile camera itself can diagnosis. It is said that these gadgets are almost 90% correct. Now, however, the long-term studies still looks like this. This is similar. I think there is a repetition of the slide. Sir, could you go to the next slide? Yeah. MEMOSA is an application. I could not get a photograph of it, but MEMOSA stands for Mobile Mouth Survey Anywhere. So anywhere, at any place, any individual, through the mobile phone, his images could be captured and this survey could be done about his own. And the last example is the, sir, please go back. Yeah, the last example is sales scope. Here you can see another gadget attached to the mobile camera. Herein, like telecytology, this gadget gives you the histopathological diagnosis. Next slide, please. The third subunit of the tele-dentistry is triage. The triage is not in the armed forces. We prioritize the patients which require emergency care. During this pandemic time, it is observed that during the initial phase, when the dental clinics, when the private clinics were closed, many times the patients, they could send their images to their dental practitioners who could prioritize them and advise them whether to stay at home and come after a couple of months or to come to the clinics immediately. The last subunit of the tele-dentistry is telemonitoring. Telemonitoring, when after having assessed the patient through mobile images or through screening, then maybe an operative procedure if required, followed by the post-operative monitoring, not visits. So this replaces the physical visits of the patient through the telemonitoring. Next slide. What are the challenges in tele-dentistry? So it looks very nice and is very nice to listen to and hear all these things, but there are certain challenges. First of all, the acceptance of tele-dentistry by dentists. They may not find it easy. They will find it very complex. They may be resistant to adopt to skills. So they need to be trained. And I would go on to say that tele-dentistry should become part of the dental school curriculum taught under public health dentistry subject. The next challenge is the patient's acceptance is the key to success. Many patients, they still are not very comfortable with this kind of consultation or telemonitoring. They want an actual or face-to-face contact with their care provider for the ultimate benefit. And lastly, there are a lot of legal requirements. Well, the tele-dentistry, like telemedicine or telehealth, has to be legalized through the legislation by the government. And the professional ethics bodies like the Dental Council of India or the National Medical Commission, they should come out with the clear-cut guidelines for the practitioners. And there should be a proper hand-holding of the tele-dentistry or the telemedicine provider. Because under these situations, I know my couple of friends who were taken to the court by their own patients who consulted them over calls. Next slide, please. The benefits. What is the benefit? Patient can immediately connect with the dentist remotely, sitting at home or at some place. So there is a lesser need for travel. Number of appointments are reduced. Patient saves on time. The dentist saves on time. There is a reduction in the waiting time. The patients have already been screened, so there is a reduction in the waiting. And patient can also seek a second opinion again through telemedicine. Since the patient has already been screened, there is a reduced chair time and the visits. And the dental healthcare provider can also connect with the professionals immediately. And through the Tele-Dentistry, so next, sir, the previous one, please. The dental healthcare provider can connect with the communities and through outreach programs if interested. Next slide, please. Now I'll come to the three distinct technologies, to which again I mean they are the example of the first is the 3D printing. 3D printing is nothing new again. However, in the dental science or in the dental and oral healthcare also now it is widely used. I'll give you a recent example of the Army Dental Center RNR and Army Hospital RNR, wherein a patient who had lost his entire mandible for whatever reason, his mandible was reconstructed of titanium and it was implanted or it was replaced. Now the beauty is that the patient and the providers are in ADC and AHRR. The lab is somewhere in Delhi. So the images and everything is captured here, transferred to the lab. Lab doesn't have the adequate expertise, probably to print an entire mandible. So they transfer images to some other country, Israel for that matter. And they got a mandible printed, 3D printed in titanium, which was transported back to ADCRR. And let me tell you, they did not have to adjust even a fraction of a millimeter to fix these prosthesis. This is the 3D imaging, or this is the remote monitor. Third is CAD/CAM, computer-aided designing and milling. This is again not new, but also this is being used in the dental sciences quite frequently. We are printing or we are milling crowns and prostheses and dentures through the system. Next slide, please. The third technology is aligners. Dental aligners, you all must have seen some advertisements in the newspaper on program known as ToothC, the ToothSW, ToothC these days. These are the aligners or clear aligners or invisible aligners. Now, we all know I myself am an orthodontist. We all know that the orthodontic treatment is and it's very prolonged care, 1.5 to 2 years, requiring more than 30 visits to the dental clinic. So what does these aligners do? Well, the patient is advised not to visit the clinic also. A resource person comes to your place, captures the images through intraoral scanners, images transferred to a location where I hope the orthodontists are involved. They plan the treatment for you if it is possible through aligners. Upon acceptance, various appliances like this, what you can see here, they are shipped to you one after the other, which you are supposed to wear for a certain number of time over a certain number of period, and expect the changes to take place in the alignment of them. So this has practically reduced or eliminated the visit of a patient to the dental clinic. This is probably the best example of the remote monitoring of the doctor. This has sent quite many shivers down the spine of the orthodontist like me, that what will happen in our profession. However, we cannot stop the technology. Next slide, please. Now I will come to the third part of the Internet of Things, IoT. What is Internet of Things? It is a network of physical objects or things which are embedded with sensors or software for the purpose of collecting and exchanging data with other devices and systems over internet for collection and monitoring of the patient's data. Okay. Why I say oral healthcare? Because of my subject. Otherwise, Internet of Things collects data for anything, and it is actually collecting our mobile phones are the best example. Now Google, Facebook, etc. they all know about everything of our daily activities without we accepting their terms and conditions or not. The IOMT are the Internet of Medical Things to track and monitor diseases. My colleague is going to speak about that subsequently. Internet of Dental Things, or IODT, are devices to track oral conditions. It is for the prevention and management of dental caries, periodontal diseases, and oral cancers. This data could be used eventually for risk assessment and research. There is no doubt that the network of interconnected computing devices with the ability to share data and have communications across the servers has revolutionized the healthcare management. Next slide. Yeah. So, what IoT system consists of? Internet of Things consists of? Well, basically, it consists of a server which could be invasive, that is, like dental implant or an implant placed over an IV, or it could be non-invasive, that is, placed on a tooth surface or into the appliance owned by the patient. The data collected through these sensors is transmitted to the server database through cloud, and it is analyzed, and there is a user interface. The two common technologies in the IoT are, first is the edge technology, that is synchronous technology, which is a real-time technology. Second is the cloud computing or asynchronous technology. The data is collected, stored, and then retrieved and analyzed at a system. I'll go through a few examples of the Internet of Dental Things. Here you can see a smart dental. This dental implant has got a sensor here. See a sensor? Yeah. Through this dental implant or a sensor placed on the tooth surface or embedded into the cavity of a tooth or alveolar bore, we can monitor the smoking habits of the individual, food intake habits of the individual, and this also allows patient follow the instructions or the diet instructions, which in turn helps in the better outcome of. Second example, the smart toothbrush. The smart toothbrush is embedded with gadgets like cameras, pressure sensors, and of course software. It is used to gather the patient data about his brushing habits and his brushing activities. So you can actually analyze how many times, for how long the patient has used the toothbrush, in which all quadrants the patient had used, the kind of pressure which he has used. You can even also analyze and identify individual teeth which have got plaque collection or a calculus, or there is a gingivitis or periodontitis. Next slide, please. The next example is mass RCNN. This is a technology which I do not know much about. However, only thing which I know is that it is used for image acquisition and of the teeth, and then diagnosis. This particular technology gives diagnosis of 7 elements like broken tooth or fractured tooth, dental fluorosis, or calculus, cavities, periodontitis, submucous fibrosis, and etc. Second is the xenogenetic spiking. Here you can see the picture, which is self-explanatory. It's a neutral network analysis, and this is for detecting the tooth structure, the tooth positioning, the spacing in the teeth, etc. Next slide, please. As General Banerji said, in his opening address, he spoke about sensors. So this is an example of a fiber optic based nano sensor. This sensor is placed in a device which is, or an appliance which is worn. This is for the detection of the S mutans activity in the human saliva. As we all know, Streptococcus mutans is the causative organ for the dental care. So the S mutans activity, can be judged. S mutans activity in the saliva could be judged through the use of this sensor. The next is the pressure transducers. That is, these again transducers are placed in the appliance worn by the patient, and they record the bite force. These are particularly useful in the patients who suffer from bruxism or the nighttime grinding, and the exact force exerted by the patients and the way they are trying to avoid and protect the teeth can be judged based on this. Next slide, please. This is the example of a smart mouth pad, and here is what I said about the integration of the oral healthcare, general healthcare concept. Okay, the sensors are embedded in the mouth guard, which is worn by the patient during say night time. And what would they do? They assess the salivary lactate and the salivary uric acid levels. Well, we know that during certain systemic conditions, the salivary lactate and the salivary uric acid levels, they go up or down. So this could be monitored by varying these size. The last is the monitoring of the cardiac diseases. We know that in the cardiac diseases, General Banerji would know better than me, that the C-reactive protein, CRP, and the IgA, immunoglobulin A levels in the saliva, they go up. If this could be measured through such devices, then we can carry out a better risk assessment of the cardiac. Next slide, please. Well, those patients diabetic like me use home care for assessing the sugar level frequently at home. So this device is something like that. If I don't want to use the blood sugar level assessment, if I don't want to prick myself, then I can use a similar gadget where the glucose testing tape is put between the gingival crevice and the gingival clavicular fluid sugar level can be assessed, and the diabetic condition of the patient assessed. Next slide, please. Well, after having given certain examples of the IoT of then I would like to conclude my presentation by saying that IoT devices and remote health monitoring offers a newer approach for better preventive dental care, monitoring systemic diseases with improved health outcomes. Portends a new era for oral health care. Next slide, please. Next slide, please. So thank you. Those were my references in the previous slide. I thank the organizers for giving me this opportunity to healthcare perspective of the. Thank you, sir.
Thank you, General Londhe. It's been a very illustrative presentation, and at the end of the talk, we will see what is in place, what is feasible, what has been conceptualized, and what we can get if we feel impossible is nothing. We now await the talk by General Aftab, who symbolizes not only the way he has blended from the Air Force uniform to the Army uniform, but also symbolizes a perfect blend of professionalism and administration. He has been a radiologist par excellence, also having had the caliber to be in the faculty as Associate Professor of Radiology in the AFMC. Thereafter, as an administrator, he's done exceedingly well as the Deputy Commandant of Command Hospital, Air Force Bangalore, at Air Force Hospital Kanpur, and at Command Hospital Chandi Mandir during the very challenging COVID times. And it's not just administration, he has excelled everywhere. He's always led a very happy team. With him, the graphs in all these hospitals have all gone up because of his leadership. And now he is in the most enviable appointment of assets under a very dynamic leadership of General Kanitkar, and with our own CDS heading the setup. So we expect a lot of change coming there with the present team of at our medical establishment in the IDS. And now, Aftab, may I request you to give a talk which most people are waiting for the vast spectrum of remote healthcare monitoring technologies and devices which you have today and which is being conceptualized for the future. Over to you, Aftab.
Thank you very much, sir, for the kind words. And I really don't know how much I deserve. And thank you so much, sir. Sir, General Aurora, sir, can I have the rights of sharing my slide? Subject, which is remote health monitoring technologies, and how does it affect us in today's world? Can I have the next slide, please? We are changing from being physical to being remote. And it started a couple of decades back when we had entry into vehicles which were remote controlled, remote entry into vehicles. Then we had remote payments. And now we have smart homes. Smart homes are, you can put on your AC, your lights, your geyser much before you reach your home. Even the entry door can be opened before you reach your home. So over a period of years, technology has helped us in our living in various methodologies and various ways. And now this technology is being translated into that which helps our healthcare delivery system. I shall share my thoughts on remote management of various diseases using remote technologies. The next slide, please. Can I have the next slide, please? Because of paucity of time, I shall restrict my talk to only what has been flashed in the slide, because if I dwell into the individual aspects of the technology or the various methodologies and the various diseases, then it itself will take very long time. So I shall give an overview on what is exactly remote patient monitoring, how does it affect, how does it work, and what are the advantages or disadvantages. Next slide, please. This has been with us since the 1970s, though in India, probably we have not been able to utilize this technology to the extent that we should have. But in the US, this has started in the 1970s. And now over a period of time, the importance is increasing. And statistics have shown that over a period of years, this technology will impact each and every aspect of our healthcare delivery system. It has immense potential, and over a period of years, it will become the game changer in healthcare monitoring, and soon will be a way forward. Next slide, please. So what exactly is remote patient monitoring? It is a healthcare delivery methodology that uses virtual technology to monitor a patient's health outside the traditional clinical setting, that is outside the setting of a hospital or a clinic. And this, how it does is the clinical data between the patients and the physician is electronically transmitted. It's a two-way transmission system where initially the patient's data goes into a server, and from there into the healthcare provider, who again gives his recommendations or treatment protocols, changes, whatever is done. So it's a two-way communication outside the healthcare facility and without contact with the healthcare provider. Next slide, please. So it's basically technology driven, and there is a wider ambit of telemedicine. So where does remote patient monitoring fit into telemedicine? To make it very simple, remote patient monitoring is a small subset of telemedicine. Remote patient monitoring uses devices for interaction between the patient and the healthcare providers, as I said, outside the care providers organization. Now, how it does, it's monitoring devices are placed on the patients, and using technology, we leverage technology and gain information of the patient's physiological and biochemical parameters, and these are transmitted to the healthcare provider. Whereas telehealth uses electronic information and various telecommunication technologies to support a remote clinical care. Like for instance, a patient is far away from a healthcare provider. So use of technology with the audiovisual aid, we can diagnose or we can treat the patient. This is telehealth. So these are a remote patient monitoring is a small part of the larger ambit of telehealth or telemedicine. Next slide, please. So what are these remote patient monitoring devices? Like General Banerji has already mentioned, there are the various devices available in the market. These are wearable devices. They can be implantable devices, but normally what we use are wearable devices, which are non-invasively, they monitor patient health data. Some of these devices, we are very familiar, are Fitbits. There are wearable heart monitors, Bluetooth-enabled weighing scales, glucose monitors, wristbands, shoes, belts, maternity healthcare trackers to find out the progress of pregnancy in ladies. There are beacons which are used for elderly and elder care. And of course, there are biosensors, which Londhe has also said regarding how these sensors are placed on the tooth, and then we get a whole lot of information. So these devices enable a healthcare provider to observe, report, analyze, treat, and follow up patients no matter where they are in any part of the planet. So basically, this is the first part of the whole technology wherein the sensors are placed onto the patients. Now, how does this technology work, or what is driving these remote patient monitoring devices? There are basically 4 components. One is capture of the patient's parameters. These are done by what I've just said. These are done using various types of wearable or implantable devices, biosensors, etc. Now, these biosensors have the capability of locally storing data which has been obtained from the patient. So you have a data which has been obtained from the patient and kept at the patient sites and subsequently transmitted to the healthcare provider. Third part is a central repository for data storage. That is, you have servers where all this data is transmitted and stored. Next, we have the diagnostic application software that develops intervention alerts. Now, using artificial intelligence over a period of time, so much of data has been fed into this software that it recognizes the normal from the abnormal. And moment you find this situation, there is abnormal situation, alerts are given to the healthcare provider, who again, in turn, modifies the treatment, starts the treatment, stops the treatment, or whatever is best has to be done for the patient. So basically, it's a closed loop system in which there are 4 major components, which I've just explained. And this is how the remote monitoring devices work. Next slide, please. Now, coming to applications of remote patient monitoring, there are plenty of applications. So what I thought will be more relevant, I have listed them out, and I shall very briefly cover each of them and tell them what are the benefits of each of these applications in their respective fields. Next slide, please. I'm sure General Banerji will agree with me that in cardiology, remote monitoring devices play a very important role. One is in blood pressure. Monitoring blood pressure is the key to hypertension management that we are all aware of. So how do these devices help us remotely monitor a patient's blood pressure and again advise? American Heart Association studies have shown that remote cardiovascular monitoring can greatly reduce the blood pressure compared to typical care and self-monitoring done alone. And here, just to record your blood pressure or to find out how the hypertensive patient is behaving, his blood pressure is behaving, he need not go to a hospital. So with this remote monitoring devices, we can monitor the blood pressure over a period of time during the day, various times of the day, and the advantage is multiple readings are taken over a period of time. And definitely this can lead to better control and better management of the patient's blood pressure. General Srivastav had mentioned about white coat hypertension earlier. I'm sure a lot of us, including medical professionals, I know of doctors who, when go to another doctor to get their blood pressure checked, the systolic blood pressure is very high. So white coat hypertension is a known thing, and this is also prevented using remote monitoring devices for hypertension management. So in overall, it is a better form of hypertension management by using these devices. Next slide, please. Another aspect is ECG records, and how do we manage such patients using these devices for their ECG inputs. So such devices are, of course, remotely. They can transmit ECG in real time. Now, again, this can be utilized during rest, during endurance or sports. So apart from patients, even the behavior of the ECG tracing in normal individuals, in athletes, these can be monitored and studied. These are again handheld, wearable, or they can be in a patch form. Various types are available. And such devices especially are useful to detect arrhythmias, which may go unnoticed, myocardial ischemia, silent MIs, which can occur and the patient or the doctor would not be able to detect or treat on time, and specifically drug toxicity, which can be evaluated using changes in the ECG much before they are clinically apparent. So using this technology and monitoring the ECG remotely benefits the patient to a large extent, and it leads to an early diagnosis and treatment of those conditions which may have been missed. Next slide, please. COVID-19, we've heard a lot about COVID-19 and how we have managed and how we have come out to a certain extent successful against this pandemic. But this remote monitoring plays a very important role in such highly infectious diseases. And for patients who are admitted in hospitals of suffering from COVID, I shall share my personal experience in managing the Sardar Vallabhbhai Patel Hospital at New Delhi and how we utilize this remote monitoring facility for our advantage of our patients as well as our medical personnel. So apart from admitted patients, the continuity of care in symptomatic patients who have been post-discharge, they are at home. Obviously, we cannot keep everybody for a long period of time in the hospitals, as there is a big crunch of beds. So patients are discharged after a reasonable period of time, but they need to be followed up. So how do we follow up? We follow up using these remote monitoring devices. Monitoring of patients with post-COVID complications. So post-COVID complications, we are all familiar with. We all know how it affects the lungs, it affects the heart, it affects the brain, and how we can monitor these patients at their homes using remote monitoring facilities, which are remote monitoring devices, which are available to us. And definitely this reduces the infections due to COVID among the medical care, healthcare personnel. Now, using these remote patient monitoring devices in a hospital setting, in a HDU setting, the paramedical staff or even the doctors need not go to the patient every now and then to check the vital parameters. And this can be done remotely and action taken accordingly. So this prevents overload of the already burdened healthcare resources. Next slide, please. Using such devices, this is our personal experience at the Sardar Vallabhbhai Patel Hospital, where under the aegis of the IDEA headquarters, IDS Medical, this equipment called DOSI, which has been developed by entrepreneurs in indigenous IIT graduates who have developed this for enhancing the healthcare facilities. We use these devices at the Sardar Vallabhbhai Patel Hospital. And this is just a wearable, it's not even a wearable device, it is kept on the bed, on the mattress of the patient, and with a probe which measures the SpO2, whereas this device, it's got sensors and it's placed onto the mattress, and it detects 5 important parameters of the patient. Next slide, please. And these parameters are the pulse, that's heart rate, you get oxygen saturation, respiratory rate, and the blood pressure. So this is all that you need to monitor a COVID patient remotely, or a COVID, even for that matter, any patient, but specifically a COVID patient. If you have these 4 parameters, you can easily monitor the status or the condition of this patient. Now, this device using artificial intelligence has the capability of giving you alerts. Now, the doctor need not be sitting there. The doctor may be at home. This device monitors 100 patients. One device can monitor 100 patients. And using AI, the device gives out alert if the oxygen saturation dips to a certain level which you do not want it to dip to, or the heart rate increases or the respiration rate increases. So this device gives alerts to the doctor, whether he's present there in the hospital or he's at home or maybe anywhere in the round. He immediately rushes to that particular area and takes corrective measures. Next slide, please. So using this device, next slide, please. These are the photographs of how, can we go back to the previous slide? At Sardar Vallabhbhai Patel, we had the personal experience of using these devices in hundreds of patients, and it was remarkable in the sense the output was very good. We could monitor effectively and without any risk of exposure to the healthcare workers. So if you see the screen here, this is the screen which is in the central monitoring station, and we get inputs of 100 patients at one go, and you can just monitor them, and with the alerts are there, then that alerts gives us that indication that this patient is not doing too well, and then we take corrective measures. And this is the way forward in various hospitals in India. It has been used, and this is the way forward where it can be utilized for highly infectious conditions, and COVID being one of them. And just for your information, this DOSI system has been installed in 194 hospitals across India, and the reports are very encouraging. In fact, here we have in our hospital also, we did a controlled trial using DOSI in about 100 patients, and similarly another 100 patients we monitored physically, and the accuracy was about 95 to 96%. And if with that accuracy, if we get that accuracy without exposing the patients to this deadly disease, I think we have achieved quite a bit. Next slide, please. Apart from COVID and cardiology, endocrine system is one thing which can be easily managed using these remote control devices, and diabetes being one of them. India being a diabetic capital of the world, such devices will greatly help our healthcare providers as well as patients, because using just one single drop of blood, we get so much of information. You can monitor, of course, whether the effects of medication is effective or not, whether the patient's diet and exercise is effective on controlling, managing blood sugar levels, whether there is any stress or illness which is affecting the blood sugar levels, track progress of treatment goals, and at the same time, if you see the healthcare provider feels that things are not going in the right direction, you can inform the patient and follow-up appointment can be scheduled. So with just one drop of blood, so much information is given. And this device, as you see here, it is directly connected using wireless connectivity to the central repository and the server. So there is no, you can't manipulate the results. Whatever eye or blood sugar reports, they are there, and that immediately gets transmitted into the server and to the healthcare provider. So all you have to do is just prick that fingertip and get the blood, and this the patients can easily do themselves. So one of the novel methods of monitoring diabetes using remote technology is this technology which has come in, and it's already in vogue. People are using it. May not be in India so much, but in the US, almost about 30 to 40% of the diabetics are under supervision are using this technology. Next slide, please. Anti-coagulation testing, we have seen time again as in our hospitals, the INR goes up, the INR has come down. Why has it come down? Because the patient has changed his medication, he changed the brand of the drugs because that particular brand was not available, or he has eaten something which is not supposed to eat. So we know that such patients, especially those with atrial fibrillation, heart valves, DVTs, PTs, they are on regular follow-up. They are advised to take the anticoagulants. They are advised drug interaction or food interaction. And such patients need regular follow-up and accurate assessment of the anticoagulation profile. So how do we do that? Once a week. Normally what is done is once a week he tests his blood in some lab, and then the reports are sent to the doctor, maybe after 15 days, and then you realize, oh, the INR is about 10, and which is very dangerous. So then you start advising, and by the time the medication is changed, it's almost 3 weeks since that INR is deranged, and anything could have happened in this 3 weeks duration. So what these devices do is at a periodic interval, they check the INR, they check the blood, the one drop of blood is taken. The results are immediately available not only to the patient, and it is remotely conveyed to the healthcare provider immediately. So there's no gap, and whatever action has to be taken is instituted immediately. So this is again another advantage of remote health monitoring for such patients who are on regular follow-up or on regular anticoagulation therapy. Next slide, please. Maternal care. Earlier, every week or once in 2 weeks, the pregnant lady has to visit the crowded antenatal department of the hospital, wait for hours before a checkup has been done, and then the gynecologist sees the patient and advises that, okay, you come again after 1 week or 2 weeks, depending on what the requirement is. Now, why can't remote health monitoring technology help the pregnant lady in getting an antenatal checkup sitting at home? It can be done. Apart from routine monitoring, we can check gestational hypertension using the blood pressure monitors, and these again are conveyed to the healthcare provider, and this continuous meticulous tracking of the BP and follow-up can be done from home itself. Similarly, gestational diabetes, about 10% of pregnancies are complicated by diabetes, and the close monitoring of the blood sugar levels. Not only that, we need to track the nutritional status, the tracking of the diet, exercise, response to medication. And all this is done instantly. We can, by checking the blood sugar levels at various intervals and getting a feedback directly to the healthcare provider, will mitigate the effects of diabetes on mother and baby. These are the medical benefits. Apart from that, there are non-tangible benefits which we don't realize. This poor lady who has a 3-year-old child at home, though she has to leave the child or take the child to the hospital, which is again not a very good thing to do. So a mother who already has a child, how does she come to the antenatal OPD? Very difficult, but this can be avoided. Now, a working mother who is pregnant, who has to be seen by the antenatal in the antenatal OPD, how can she remember so many dates, so many appointments? So again, they tend to miss out on their appointments. But with this technology, these again can be avoided, and frequent trips to the hospital cost money as well. And that is so if you combine all these things, apart from the medical benefits, there are other benefits as well, which most of us don't realize and we realize only when we start using these remote health monitoring devices. Next slide, please. Elder care. Daljit also had the same problem. No. I can't see. Oh, you are.
Then wait, see if you can just ask if you're audible.
Am I audible, sir? I think I've been locked.
Yes, you are audible. Carry on.
Keep watching.
Elder care is another one
Yes,
important.
Aftab, carry on.
I can be heard, sir?
Yes, very clear.
Okay. Elder care is another one aspect which this technology can help us. Now we have, as General Banerji had mentioned, patients with dementia, Alzheimer's, they are at risk of falls, and subdural hematoma is one such thing which can easily affect their lives. So continuous monitoring by these remote patient monitor sensors, which can be either fixed to the individual or to the assisted mobility devices like sticks or canes. So that will help them in a way that will help them in to check their gait, to check their mobility, their angular velocity, and all these things, and prevent falls. Now, even if they don't prevent fall, they can always be sort of, the fall can be reported to the healthcare provider and immediate action can be taken. So these sensors are very important, and the patient's gait can be monitored, and corrective action can be taken, which can prevent the fall, and which can emergency management can be done. So this uses a mathematical algorithm which predicts. How does it predict the fall? It predicts the fall using movement changes in the angular velocity, and alerts are given if the individual has fallen. Another thing which we are very common, and we see in patients who have dementia and Alzheimer's is wandering adults. It's a terminology, it's a well known. And how do we track these wandering adults? There are sensors available which can either be placed onto the body or implanted in under the skin, with which.
Yes, you are.
So I think I'm back on my own laptop, thanks to General Kanitkar. It feels more reassuring. So wandering adults is another aspect where we need to work on, and either the biosensors are placed on their wrist or under the skin. More important is implanted, because with these patients, they may sometimes wear them, they may not wear them, they may throw it off because their status is such that this cannot be ensured. So these are GPS-enabled devices which can locate the wandering elder. And this has happened. We have ourselves seen so many patients who are suddenly you get on WhatsApp that so and so is left missing, and please try and find out. So if these sort of GPS-enabled trackers are put in them, that will help them in a lot of way. Next slide, please. Smart scale. Yes, we all have scales in our houses, in our bathrooms, where we keep measuring our weight again and again, which doesn't seem to reduce. But these smart scales are those scales which are again connected via Wi-Fi or cellular network, and the weights are directly conveyed to the healthcare provider. Why is it important? In cases of congestive heart failure, in cases of chronic renal failure, we need to monitor even the slightest gain in the weight, because that will prevent any further aggravation of the existing disease. Even a 1 to 2 kg gain means water retention, and that means either the heart is again not functioning properly, or there is a severe underlying renal disease. Obesity also requires to be corrected, because here with these smart scales, we cannot lie. They don't lie. Unlike us, we tell them that yes, our weight is normal or weight is reducing, but these scales give you the correct and accurate measurement of the individual's weight, because they are directly connected to the healthcare provider system. Next slide, please. So what are the benefits? I've already in my talk detailed sort of outlined the benefits. So just for a recap, this is a personalized and a detailed health information is provided to the healthcare provider. The patient has faster access of healthcare services by the patient, because his data is being fed in real time. Within seconds, the data is available with the healthcare provider, and then he acts immediately. So the patient has, yeah, that's right. So faster access to the healthcare services by the patient, because his data is directly and real time being fed to the healthcare provider. Now, more important, it empowers patient through ownership of health data. So there is an element of ownership, that this is my data which is going there, and I am going to get information immediately on the treatment schedule, whether there's any changes or not, or the doctors will respond. So we have involved the patient in providing his own healthcare. So that is a great benefit, psychologically as well as otherwise, to the patient. And of course, it enables early detection of the disease or the deterioration in the disease pattern. Thank you. Next slide, please. Studies have shown that this is a US study which estimated risk of hospital admissions after a group was using remote monitoring, remote patient monitors, and a non-RPM group. So we have seen that there is almost 4 times less admissions of those patients who are using remote patient monitoring devices. So one is it reduces emergency visits, hospitalizations, duration of stay. And of course, this leads to reduced cost, both to the exchequer as well as to the individual, and reduced load on the overburdened hospitals and clinicians. All over the world, there is a shortage of doctors, there are shortage of super specialists, and using this technology, we can reduce the burden on the hospitals. And overall, if you see, there are improved patient outcomes. Next slide, please. Now, everything is not hunky-dory. There are issues. And what are the issues? The accuracy of data and information integrity. That is very important. We have to have enough data to say that, yes, this system works, the transmission is perfect, and there is information integrity is maintained. This will only be, time will only tell, and probably better technology can assure us of this. Now, unintentional and intentional wrong data feeding. Now, this happens manually also. The reports do get mixed up. I'm sorry. But this wrong data entry or wrong data of one patient to the other, that can become a big risk to patient safety. So we need to establish protocols and various methodology to prevent this wrong data which has coming, because then the whole treatment schedule will change. Most important, data privacy and cybersecurity. Now, this is a burning issue. Medical information between provider and the patient is strictly confidential. We all know this, because when we see a patient, the information is strictly between the doctor and the patient. But using these technologies, are we limiting our data to only between the doctor and the patient, or it is open? It's I wouldn't say public domain, but yes, once this information, the system is broken down, it is in public domain. So the challenge is to maintain privacy of the patient health information, and technology needs to be reinforced to achieve this. And especially in the context of the armed forces, because we don't want that either our individual or our collective data be shared by those individuals or those countries which we don't want them to know. So this data privacy and cybersecurity will have to be addressed by the technology providers in a way in which it becomes impossible to leak the data out, or any unknown person or accessing the data of private data of the patient. Next slide, please. So these are what limitations are. There's dependent on patient motivation. Like I said, there is ownership. He has ownership of his data, but then that depends on his motivation. How much he is willing to get the blood test or the ECG or the biosensors implanted or placed on him. The motivation, willingness and patient participation is very important to ensure that this technology is successful. Now, there is a continuous flow of patient data 24/7 from whole lot of patients, which requires a dedicated healthcare provider, a team of dedicated healthcare providers who 24/7, they are monitoring this and sending alerts, which leads to, again, a high cost. You have to pay for it. So whether we are able to or whether we can afford this is another question which needs to be answered. A very important aspect is accountability of healthcare provider. Now, every time an alert comes to him or her, is he supposed to respond? And if responds, in what way is he supposed to respond? So we need to chalk out this accountability of the healthcare provider also in a way in which it's a balancing act. He cannot be available or 24/7 to even a small variation of 10 millimeters systolic in the BP or a small one, maybe a ectopic on the ECG. So these needs to be addressed and these protocols have to be laid down. A standardization of data exchange and interoperability, which means that a number of components are involved in this. We have the sensors, the local data at the center, at the patient side, then we have a repository of data. So synchronization and standardization is very important. So here again, the technology needs to be perfected and to be improved on, and this will happen over a period of time. Now, extensive wireless telecommunication infrastructure is the backbone of this. So only where we have a good 4G or maybe 5G or communication systems, this will work flawlessly. This has happened. This has worked in advanced countries in the US and UK. This is being done, and the statistics have shown that this is increasing. Maybe it will take some more time in India to develop, or maybe the metros can sort of take this technology and imbibe this technology and provide the healthcare which is required using this technology. But for it to be pan-India, I don't think it will happen in the near future. However, we have this as we should keep this aspect in mind in the overall benefit of patients as well as burdening the load on the healthcare provider. But the bottom line is the technology has to be robust. The systems in place have to be robust. Only then this will see light of the day. Thank you very much for your kind attention. Thank you, sir. I've finished.
Thank you, Aftab. As we say, we have to remember our father of the nation who said, "Be the change you'd like to see in the world." So we have to move our baby steps very rapidly forwards. We have a visionary Honorable Prime Minister who has pushed in Atmanirbhar Bharat. We have a very supportive Raksha Mantri ji who is there to support all our projects, and we have a very top-end senior-most leadership in the 3 services and the office of DGAFMS. So it's up to them to take up the project and hand over the baton to the next leadership. And I am sure we have started this sort of a system, because to give you 2 examples, when I was in Udhampur 10 years back, that's the time we used to get the ECGs and biomarkers of patients from physicians and MOs on WhatsApp. And from cardiology center Udhampur, we used to push them to give early thrombolytic therapy. So that's some sort of a remote monitoring system, if you call it. And we used to also monitor high-risk pregnancies for IUGRs in getting weight records and blood pressure of pregnant ladies. You've seen the terrain in JNK, how difficult it is. So we have started in some way now. The idea is to push it forwards. We again have challenges which the other community doesn't have. We have ex-servicemen and veterans and dependents from whom cybersecurity is no issue. But on the other hand, we have a regular armed forces personnel where cybersecurity and privacy is a very major issue. And to further that, are high-risk people like commandos and ghataks and Marcos. We know the risks of leaking out their cyber security and their positions are. So these are issues and challenges which the senior leadership and the policymakers have to take. And let us not forget the number of sudden deaths we've had in the past, sudden cardiac deaths. All of them have receded because now the focus is on COVID and other issues. I'm sure these sudden deaths in which we have lost so many and which we continue to lose so many serving people are all avoidable by this remote monitoring system. Whether we are going to give it on an issue to soldiers as a part of their kit, these are policy matters which need to take, but I'm sure impossible is nothing, and if we get down to it, and as we all know, we should be the leaders in this sort of a project pan-India, and we have everything with us. We have the wherewithal, we have the think tank, we have the everything. We just need to give it a push, and the demerits and the hiccups, I'm sure we have our signals people and our others to help us, guide us, and push it through. So this is what innovation is all about, and I'm sure it's going to be a very satisfying so-called project by our AFMS and the armed forces and at large to take us to the next level of healthcare management. So with this, I leave it to the panelist speakers and the organizers to close the session and make some more comments. Thank you.
Am I audible, sir? Thank you so much.
Yes, sir.
Banerji and General Londhe and General Aftab, thank you so much for your interventions. And I think at the end of the day, the possibilities are enormous, but the issue here is one of a marriage between the technology and the requirements of information communication technology that is available in peace stations, say smart stations, small Air Force bases where the populations are low. Pilots can be run there to draw lessons, but then in field areas, in large geographically spread locations, how these things can be. I mean, of course, pilots will have to be done there too to find out what is the requirement. So at the end of the day, it's an issue of bandwidth, it's an issue of finances, it's an issue of scaling, and it's an issue of policy and prioritization as to what segments do we want monitored, what critical areas or activities that we want monitored. Should it be across the board? It has to be like General Banerji said, baby steps. So policy interventions as well as changing our practices, the way we deliver healthcare, and then learning lessons from them. So it will be, I think, a mix of what we learn as we go along and how we evolve as far as policies are concerned. I'm sure funds will not be too much of a constraint. It's more of the bandwidth issues. So thank you so much. I think very informative, very encouraging, and very reassuring to know that these practices are being adopted in whatsoever small scales they might be. So there will be delivery eventually.
Thank you, sir.
Thank you so much, everyone.